I think if you speak to any patient with chronic lung disease, what they fear most is getting a respiratory virus infection because they know that it will go to their chest and it will worsen their symptoms. And quite frequently, they end up in hospital. And if they end up in hospital, they quite often stay there for a protracted period of time and they quite often get readmitted to hospital within a month or two afterwards. Something like 30% of COPD patients get readmitted. So they fear these virus infections, and this is the first study to show a positive outcome with an antiviral drug that will treat 75 to 80% of common colds. And COPD patients will be very enthusiastic to have this drug in their home when, if and when it gets to that stage, which I sincerely hope it does. They have rescue packs at the moment, which contain steroids, which they hate taking, antibiotics, which they don't mind taking so much. But people are generally concerned about antimicrobial resistance. If we can put an antiviral in there, which will prevent the worsening of symptoms and hopefully also prevent secondary bacterial infections and reduce antibiotic use and antimicrobial resistance, this will be a great step forward for them. And that was very clear for us also just by the numbers of people who volunteered for the study and were willing to commit to a study involving 16 or 17 visits lasting about 2 months and being given a virus that would worsen their symptoms. They were very keen to do it because they knew that this was an important step forward.